just about bringing you into the here and now, grounding your body, moving you out of that sympathetic mode into the parasympathetic so that you can start to just slowly turn down that volume on the pain.
How does the nervous system contribute to chronic bladder pain and inflammation?
So nerves are what send pain signals. So that's a really important point to start with. It's not just pain that you're feeling because there's inflammation. If you cut your finger doesn't actually have any pain in it. Your brain is sensing the pain via nerves that are leading to
Hmm.
it. So it's this body signaling that we're talking about. There was some really brilliant research on nerve sprouting with recurrent and chronic infections. And the longer the problem persists in the bladder sprouts more and more nerves out into the lining, creating more pain, unfortunately, turning up that volume dial for you. So we need to think about what is going on. Is there actually an infection there that is sending that pain signal? Is there a reason that pain signal is being sent? Or is it that these nerves are on hyper alert still and over signaling to the brain that something is wrong?
It's really complicated. I just read some research recently about endometriosis lesions being able to grow their own nerves as well. So then we have these nerves sending signals for something that we may not necessarily need to know about, and we certainly can't do anything about it. But it is still a problem. It's indicating that there's a problem there. So how do we then address this inflammation and the nerve signals? We can't necessarily do anything about the bladder pain every time that we feel it. And so, how do we approach that problem of differentiating when we should get medical care as opposed to when we just need to take a different approach to address the pain signals themselves?
So that's a really tricky question because I think any time that there is a problem that is amplified beyond what it has been before, we need to seek medical attention.
Hmm.
So red flags are things like persistent pain or a new pain, any blood in urine, or unexplained bleeding from the vagina or the rectum. So I think all of these things need medical support, but we know
Hmm.
quite well if you've got a recurrent or a chronic situation in your bladder and you go back to your doctor again and again and again, unless you've got a really great one, quite often you are being dismissed because nothing's coming up on the culture, nothing's coming up on the dipstick.
Hmm.
But these things should have medical intervention. There should be a medical assessment at least. You know, the red flags that I would send somebody to a doctor with are things like unexplained weight loss, that persistent or new or unexplained pain, night sweats and recurrent fevers, fatigue that's ongoing, unexplained bleeding, as I said, lumps, masses, swelling, changes in bowel habits. I mean, how many people end up with diarrhea when they go on antibiotics, but they're not going to the doctor about
Hmm.
it? Chest pain and shortness of breath and persistent nausea and various other things that aren't necessarily connected to the bladder. But there's quite a few of them that I say, you know, you've got to go and see your GP
Hmm.
about this, but then they might be sent away again because the doctor says it's nothing. So it's really hard to say when is this a medical problem and when is this just the bladder over signaling. But I think what we need to think about is calming the nervous system
Hmm.
and, you know, looking at it from that angle because the nervous system itself is what is driving this over signaling of pain, this turning up of that volume dial. So if we think about the nervous system as being part of it, there's lots of different parts of the nervous system, but one part of it's called the autonomic nervous system, and it has two components to that. There's the parasympathetic and the sympathetic. Parasympathetic is your rest and digest. Sympathetic is your fight or flight. Now, here I am being interviewed, so I'm definitely in fight or flight at the moment, but I would calm down afterwards and go and be able
Hmm.
to eat my lunch and be in a calm state. And that's being able to flux between these two states without it being problematic. But when pain or something like that is ongoing, we can get shifted into the sympathetic and find it very hard to come back down into the parasympathetic because pain creates fear. But then
Hmm.
if we add in these conditions that are under researched and we have inadequate testing with no clear results on them, and being told sometimes that it's all in your head because there's nothing on the test, this just bumps up this fear response,
Hmm.
sticks you further and further into that sympathetic mode. And with that, our brain becomes more and more hypervigilant. So it's looking for any small little thing that to be fearful of. So rather than being sort of having a wide open vision and being able to take in the world as a whole, it becomes more blinkered and everything becomes a threat, a fear thing.
Hmm.
So this hypervigilance is what we need to turn down. And that's where we really need to sort of be thinking about how do we create a feeling of safety in the body? How do we start shifting that brain back out of that sympathetic mode, sometimes into the parasympathetic? And there's a few things that we can do for that, but it does take a little bit of time to rewire the brain.
That's an interesting topic though, because we do get the question a lot. How do you know if it's still infection or if it is this amplification and you're just on this high alert always? And you just said that you feel like you're in fight or flight being interviewed. But when I talk about this topic with people, sometimes I start to think, do I feel bladder symptoms right now? Am I feeling a burning sensation? I don't know if that's real and whether it's just this stress that I feel when we talk about these topics. And I hear these types of sentiments from the community all the time. They can't tell if it is something stressful that is making them think about their bladder or if it's the constant thinking about the bladder that is causing this. It's a cycle. And obviously, for a lot of people, there is infection present. But is it possible that for some people, they have recovered from infection and they still have these feelings of pain or burning sensations in their bladder?
So this research paper, I think it was from last year, that I referred to earlier, was talking about how, yes, once the infection is gone, there is still all these nerve fibers that are out and are over signaling. But there's no way of really knowing
Hmm.
unless you are repeatedly testing, repeatedly biopsying the bladder, repeatedly looking in there. Um, so I think we have to just take into account that this is something that anybody with a bladder condition should be doing.
Hmm.
You know, as I say, yes, I may be in fight or flight right now, but that's not a bad thing. That's because that's adrenaline pumping because I'm thinking and I'm being spoken to.
Hmm.
That's not a negative. We're meant to be able to go into fight or flight. It's about being able to shift back out of it
Yeah.
again afterwards. So, how do we create safety? How do we create a feeling of being okay? And it's not, unfortunately, about stopping the pain, which a lot of people obviously want that to happen.
Hmm.
It's about changing our perception of the pain. So, the first thing is finding a place where you're being listened to, where you feel like you're being heard. And that might be with finding a decent doctor,
Hmm.
working with a holistic specialist, but working within a community, whatever it is, that feeling of being understood and heard, that is one of the first steps of starting to feel safe.
Hmm.
Finding hope is incredibly important because without hope, you're never going to heal. It's a huge part of what I do in my clinic. Even when somebody just contacts me for a discovery call, I have a sequence of emails that go out, and one of them is with testimonials in there of people who
Hmm.
did recover. Because if you just start planting that seed of hope, it gives somebody that little thing to latch onto, and that becomes safety as well. Um, you know, all the things like deep breathing, meditation, mindfulness, all of these things have been proven to slow the response that's happening in the brain down, calm everything back down, and shift you back over into that parasympathetic a little bit. There is no time frame on this, how long it takes, though. It can
Hmm.
take a really long time, and it's about constant practice. And, you know, each person will need to be sort of thinking about this in their own light, because some might take a few weeks to start feeling safe, others might take months, and some might never feel safe because there's so much going on. Perhaps they have a trauma history, a trauma background where they've always felt unsafe as well, that they're always on high
Hmm.
alert. So I think there's a lot wrapped up in all of that.
It is a tricky thing to ask someone to find hope when they've been dismissed by multiple clinicians and they just haven't found answers. And we acknowledge that too. And one of the things that we try to do is to share stories, like you said, testimonials. We want people to know they're not alone, even if they're still at the point in their journey where they haven't found any answers. It's really important to know that there are people out there with similar experiences and there are many people that want to help. And then it's just trying to find what that next small step can be. And we have heard from a lot of people in the community who have started doing breathing exercises or mindfulness or neural rewiring training and have found that to be very beneficial even after decades of experiencing symptoms. And it might not cure an underlying infection, but it has helped them to manage their daily life and to give them back some quality of life, which is really important. We had a few specific questions about the way the nervous system interacts with symptoms and whether if you experience vulvovaginal pain or itching, it might be a nervous system issue. Especially the itching one's an interesting one because we think of nerves and pain, but not necessarily itching. Do you have thoughts to share on that?
Yeah, so it's a tricky one, isn't it? Because there may be a bacterial or fungal
Hmm.
presentation causing that as well. And certainly with clients who have come to me saying they have vulvodynia and they've been given a vulvodynia diagnosis, we then go and use next generation sequencing testing, and we find either a bacterial or fungal or both overgrowth
Mm.
going on in the vagina. And once we resolve that, the vulvodynia symptoms die down or go away completely. So is it nerve? Is it bacterial, fungal? You know, what's going on there? It's unpicking all of that, and it's never going to be a set thing for each person. But yes, definitely, I think, going back to that nerve sprouting, you mentioned about the endometriosis as well. We're understanding more and more and more where there can just be more additional nerve sprouting happening.
Hmm.
So I think, we need to think about, is that something that's going on? And again, that then comes back to the brain and how it's perceiving that pain and the volume button that's being turned up on it. So there are obviously other nerves in the area. I'm not going to go into like the pudendal nerve and things like that because I'm not a pelvic floor specialist and this
Hmm.
isn't quite my area. But there are specific nerves that run through our pelvic bowl, and they can either get trapped or they can become oversensitive. I mean, most of my clients I refer back out to see pelvic floor specialists
Hmm.
because quite often, even just when you're in pain, if you think about it, when there's pain, you're going to tighten up. You kind of, everything gets a little bit tighter. Um, and that in itself can cause specific parts of the pelvic floor to tighten up. So quite often, some people might just have one part that is tight.
Hmm.
I had one client where her UTI symptoms um, seemed a little bit, she actually came to me very early on in her journey, and her symptoms seemed a little bit kind of not unusual, but they didn't quite fit the mold, as everybody's don't really, but hers
Hmm.
specifically didn't. And I recommend, because of other things that she'd said as well, like pain with sex and things like that, I referred her out to a pelvic floor specialist. She then also happened to have urethral a cystoscopy, and they did urethral dilation because they said it was too tight around there. And
Hmm.
then the pelvic floor specialist said that she did have a hypertonic pelvic floor. And actually, as she worked on all of that, her UTI symptoms decreased. So maybe
Hmm.
it was just urinary retention in the first place that was causing bacteria to stay pooled in the
Hmm.
bladder that was causing the problem. There's so much wrapped up in it. It's such a complicated, massive things going on down there.
It's very complex for a lot of people, and it's one of the reasons it can be hard to figure it out on your own. And sometimes you need input from specialists in different areas of health just to get that resolution of symptoms. Are there specific practices or supplements that you recommend to address this nervous system regulation?
Yeah, so I think, breathwork, hugely,
Hmm.
absolutely. I love doing a body scan. So I imagine my breath swirling around my brain, around my mouth, up my nose and out into my throat and out my shoulders and out, down my arms, etc., passing the whole way through the body. That can be a really good one to do before bed.
Hmm.
Don't disassociate from your bladder. Pull that breath into your bladder as well and imagine it being whole and healthy and well. And I think that can be really important. Having a nighttime routine where you're calming yourself before bed, because when we're in that fight or flight response, cortisol is being pumped around our body, adrenaline is being pumped around our body. We
Hmm.
can't sleep like that. We need to calm down before being able to sleep well. So having a nice calming routine before we get into bed can be useful with that. Looking for small wins in our day, so little glimmers of joy that happen, maybe a smile from a child or a rainbow you see, or even a sunset, something like that, where you're focusing on the little bits of, not joy is a big thing, isn't it? But like little things that happen, the little glimmers of something nice that happened in the day. Trying to be present in the here and now rather than the past or the future. This is very difficult for somebody in
Hmm.
pain. I totally
Hmm.
get that being in your body right now is really important, and then not being stuck in support groups continuously. And I know they are amazing places and they offer so much support out there, but they are also places of despair as well.
Yeah.
It's not being in them at all, but give yourself an allotted amount of time. Don't make it just before you go to sleep at night. Maybe it's 30 minutes in the morning where you have a look, you look for specific questions or a specific word that you want to research, rather than scrolling through and just seeing everybody who's in an awful state. And obviously, there are wonderful stories that go out into them as well. And I get a huge amount of my clients through these Facebook groups. So I'm really not trying to disparage
Yeah.
them, but they are places where you can get really sucked down into as well. As I mentioned, finding stories of hope, as you said. not using Dr. Google too much. Again, everybody wants to support themselves and they're not getting enough information out there. But for instance, your organization does a huge amount around this. So looking at somewhere like yourself at the Live UTI Free and looking what's going on there rather than relying on Google for answers, I think can
Hmm.
be really helpful. A lot of people are now using Chat GPT. It's fantastic, but it's not looking at you as an individual. It is looking at whatever it can draw up off the internet. Chat GPT is also a people pleaser and it will tell you whatever you want to hear sometimes, I think, as well.
It's also relying on the same misinformation in women's health as everybody else's, and
Absolutely.
it's hard to get through that layer. But I think what you said about support groups is a really important point. People often find that they're amazingly useful, especially for finding similar experiences or discussing certain topics. But there can be times when it's just not good to be in those environments. And a lot of people have said that it's helpful at certain parts of their journey. Sometimes they need to be outside those groups while they focus on their health and return to the groups when it's useful. And the groups are amazing in that way. You can come and go as you need them. And probably, like you said, just before bed is not the right time to be scrolling through groups. I found that personally too, that it's not something that I should focus on a lot.
Absolutely. I think also a little bit of movement in the day, which can be so hard if you're in pain. But even if it's just getting outside your front door or your back door and getting some daylight onto your face, if you can walk around the block, do. If you can make it to a park, even if you're driving to the park, to walk short distance into the park and then to sit on a bench. Being
Hmm.
in nature is so important. Our eyes need to see a different light. And we don't get that just through a window. The UV light is sort of blocked. If we can, watching the sun rise and the sun set, we get a different light coming into our brain then as well, which can affect our pineal gland and really help us with our wake and sleep cycle. Grounding yourself, doing things like walking with your feet in the grass. I mean, not particularly now it's getting
Yeah.
colder, but it can be really helpful just to feel the earth underneath your feet. And there's huge amounts of research around how, we are electric beings and we have these atoms within us, and actually the ground can sort of ground us as well, which is really useful sometimes. And if you can move, something like shaking yourself or
Hmm.
dancing, doing somatic dancing where you just kind of wiggle and move to the music can be really helpful for getting adrenaline out as well. If you can't do that, just tapping up and down your arms,
Hmm.
bringing yourself back into your body whilst you're doing some breath work with that can be really useful as well. And as I said, none of this is going to magically stop your bladder pain, unfortunately. It's just about bringing you into the here and now, grounding your body, moving you out of that sympathetic mode into the parasympathetic so that you can start to just slowly turn down that volume on the pain.
How long do you think you need for breath work for it to be effective? Does it have to be an hour before you go to sleep, or can it be five
No.
minutes?
No, literally like 5, 10 minutes, do a little bit. I always think doing a small amount of something is really important. If you
Hmm.
like, I couldn't do an hour of breath work. I just don't
Neither could
have that
I.
in me. But, I always try every day to do maybe 10 minutes before I see my clients where I
Hmm.
ground myself. I imagine roots coming down out of my feet into the ground and tapping into the earth and just doing some breathing, maybe doing the body scan. And that just starts my day. But it's never more than 5, 10 minutes of doing that. And same before bed, just a few breaths, just bringing yourself back in. There's a great breath work called 478, which is there's a TED talk by a guy called Max Strom, I think it is,
Hmm.
and he explains it to you and gets the crowd to do it. And you breathe in for 4, you hold for 7, and you breathe out for 8. And that holding of the breath and then the long, slow breathing out helps to shift you out of that sympathetic back into parasympathetic. And it can be really useful just doing something simple like that.
That's good to hear because that's the approach that I adopted after my surgery. I decided I needed to do some breathing work just to heal from the endometriosis surgery. And the 478 is kind of where I landed as the one that feels the most comfortable as well. So I've been trying to do that. It's hard to incorporate into every day, but I do find that it is helpful for just calming everything down.
Absolutely. You mentioned supplements, I think, didn't you, to help with
Yeah.
nerve-related symptoms. So vitamin D is one of my most used supplements. I do tend to try and get clients to test first of all. It's not just a case of everybody should be taking vitamin D, but
Hmm.
most people are deficient in it. So it helps to modulate the pain perception and it supports immune and nervous system balance as well in the body. I try and get my clients somewhere around about 100 nanomoles per liter. In the USA, that would be 40 nanograms per liter. So they're
Hmm.
different measurements that we use, which is higher than what your doctor is looking at, but not crazy high.
Hmm.
And certainly there's some research to back that up as being useful for the immune system. So that's something that we can use. Magnesium is really useful for calming the nervous system, calming down overactive nerve firing, reducing muscle tension and pain sensitivity as well. So that can be
Hmm.
really useful. And it can be used orally, or you can actually use it on your skin as a transdermal or with magnesium salt baths as well. Omega-3 fatty acids, so we can get these from fish if we're eating fish 3 times a week. Oily fish is a nice acronym of SMASH, so salmon, mackerel, anchovies, sardines, and herring. Tuna as well has good oily fats in it as
Hmm.
well, but they don't have that in the acronym. And then from the vegetarian side, things like chia seeds, hemp seeds, and walnuts all contain good amounts of omega-3 fatty acids, but we have to convert them, whereas the fish have already converted
Hmm.
the various fats down to EPA and DHA, which our cells want to use. And we need zinc for conversion. And so many people are deficient in zinc and the various B vitamins that are actually needed for this sort of 5 or 6 pathway conversion that needs to happen. You can obviously take it as a supplement as well, but they have anti-inflammatory and they support the nerve membrane as well and the integrity of that, which is really important. And then there's some B vitamins as well. I try not to use B vitamins as a singular, rather than I always use them as a complex.
Hmm.
But sometimes it is useful to go in with higher amounts of certain things. But B6, which I'm about to mention, doesn't want to be too high because you can have toxicity with that.
Hmm.
And I find that a lot of people with bladder issues say they have a B6 issue, that it aggravates their bladder.
Hmm.
Clinically, interestingly, I find not many actually do, but a lot of people say that they do, and then
Okay.
we maybe try it and they don't. It's one of those things where, people start talking about, well, this thing will aggravate your bladder, and they go, oh, well, that's going to aggravate my bladder. So it becomes their story without actually trying it.
Hmm.
Always useful to try. But B1, B6, and B12 all have functions within the nervous system and can help support nerve repair and myelin sheath formation. So our nerves are wrapped in this thing called myelin sheath, which kind of,
Hmm.
if you imagine in your home, your electrical cables, they all have plastic around the outside, and the myelin sheath is basically that plastic wrapping around them. So we can use all of these in combination to support neuropathic support in the body. Curcumin is another one, which is easy to get via food from turmeric, a lovely spice that we
Hmm.
can use. It's anti-inflammatory and is also a little bit calms down neuroinflammation as well. There's a product called P that I can never pronounce the full name of, but it's a natural fatty acid that we make in the body, and it can calm down nerves and quieten that pain signaling that's going on, and mast cells as well. There are some studies around it in vulvodynia and pelvic pain, and a little bit in
Hmm.
interstitial cystitis and bladder pain syndrome as well. So that's quite a nice one to use for some people. I do find that it needs to be used over at least 3 to 4 weeks before some people will receive any sort of benefit from
Hmm.
it, but it can be used. Alpha lipoic acid is another one, which is a potent antioxidant. It can work really well in the body. And there's lots of research around that in diabetic neuropathy and things like that for reducing burning and tingling sensations. Whether that would cross over to the bladder as well or not depends on the individual.
Okay. Seems like there are quite a few things that you can potentially consider for nervous system regulation. What about on the side of prevention and treatment of UTI itself? Do you recommend certain supplements for that?
So prevention's a hard one. I think, we need to be, again, thinking about the body as a whole, and it's not just about throwing in supplements
Hmm.
willy-nilly. But I think, yeah, there are definitely things that we can use to try and, if we know that somebody is more prone to getting UTIs, that we can think about things beyond antibiotics. I do need to say, though, that antibiotics is always the number one approach that we should
Hmm.
think of for a UTI. This is never one or the other. But for people who can no longer tolerate antibiotics or are looking for a different approach to it, then there are definitely things that we can use. But we need to think about what the body needs rather than just throwing everything at it. The amount of times
Hmm.
people come to me and they say, send me a list of all the supplements you've got, and there'll be sort of 30 different bottles of pills that they've bought. And are any of them working? They don't know because it's not targeted. So we do need
Yeah.
to think about the individual. So you might want to think about, are there any nutrient deficiencies? Is there anything that needs bumping up at all in terms of that the diet isn't supporting enough? Antimicrobial herbs, probiotics, as we've mentioned before,
Hmm.
supporting the vaginal microbiome. Soothing the bladder lining, so demulcent teas are useful there, slippery elm, things like that. Supporting the immune system, supporting that nervous system, supporting any membrane health throughout the body. And I think also hormonal support's an interesting one because there's so much research around estrogen and
Hmm.
vaginal estrogen and UTIs. And, we think about perimenopause and menopause as being low estrogen states, but also when people are postpartum, sometimes they're in a low estrogen state. And I've certainly had clients that have come to me where they're having recurrent or chronic UTIs since giving birth to their
Hmm.
child. And sometimes in that case, vaginal estrogen has helped there as well. But obviously, always discuss any medication like that with your doctor.
There are a lot of things. The 30 supplement bottles, I think, is familiar to a lot of people in this community. My supplement cupboard also is a graveyard of things that I've tried and haven't worked. I think I've got a bit of a routine down now. We got a really specific question for people with long COVID who are experiencing bladder symptoms and they suspect a microbiome disruption. What preventative strategies would you recommend in that situation?
So I am not a long COVID specialist. I have to put my hand up straight away and say that. I have had a couple of people come to me with long COVID, but they have been working with a long COVID clinic at the same time. So in terms of specifics around that, we've really just tried to look at what was going on in the bladder
Hmm.
with the microbiome and support that, looking at membrane health, and mitochondrial health, so the energy production that's being made in the cells, and looking at things from that side, looking at zinc as well, and trying to work on things from if there's a zinc deficiency for the immune system, but also in terms of how it can affect the process of that cofactor of things, kind of the chain event of things happening. Um, and then, yeah, thinking of the nervous system support, vitamin D is a huge one in that side of things as well,
Hmm.
magnesium and the B vitamins. But really, it kind of comes back to looking at the microbiome. And so, yeah, like I say, I'm not a long COVID specialist, so that's not my area of expertise. But I've worked with people where we've worked on the bladder and the vaginal microbiome and sometimes the gut microbiome as well, and seen improvements. But, long COVID is a long, unfortunately, as the name says, process to go through to
Yeah.
get back onto their feet again. But certainly improvements have been made.
Okay, that's good to hear. Another area that we get a lot of questions on is UTIs after sex and whether you have any prevention strategies for that.
So yes, definitely. I think we need to be thinking about what's going on between the two individuals. Some people seem to be able to have sex without having any problem with their UTIs, and other people can't go near anyone without having a UTI instantly. But there are some things we can do, certainly. I think the first thing to be thinking about is what's going on with your vaginal microbiome. That's going to be perhaps the first point of call. Is it robust enough? Is it healthy enough? Are there problems there of itself? Does your partner have an issue that is being brought into that space and causing a disruption for you? Or is it just the disruption of tissue that is causing the problem in the movement of your own
Hmm.
microbes? So before sex, you can both wash. And this can be for male to female partners or female to female, because we know certainly with BV, there's been a lot of research recently into how male partners are passing on BV to female partners. But we know from history there's been quite a lot of research around this, and it's the same with same-sex female relationships as well, that they will
Hmm.
share the microbiome. So washing, both of you. For men, if they can use an intimate soap on the penis, if they're not circumcised underneath the foreskin, there can be a lot of bacteria that's held within that space. But it's like all of our skin, everywhere on our body, it's going to contain
Hmm.
bacteria. For women, I suggest not washing the vulva with soap. It's really important that we are not introducing anything that might disrupt the pH there. If you need to use a pH balanced soap or an intimate soap, then do, but really water is enough. Never douching the vagina, never washing it out is really important because it can shift the environment completely in there. And then something that's really important is making sure you're ready to receive.
Hmm.
Take time over this. Don't rush it. Don't like just, oh, if we get it over and done with, because it will please the partner. We need to make sure that we are open and receptive and feeling willing to go through this. It's really important, that part of it. You can start off just by massaging the pelvic floor and the vulva and actually allowing it to relax a little bit. That can also be beneficial because, again, if we're fearful, if we're scared, we're going to tighten up a little bit.
Hmm.
So we need to relax with that. Using pH balanced lubes, I think, even if you feel like everything is wet enough and lubricated enough, actually having a little bit of extra lubrication can be really helpful.
Hmm.
Fragrance-free condoms, don't put anything that's scented or anything that glitters or tingles, nothing like that down there. I'm sure none of your audience would be doing that, but just to double check. Avoiding spermicidal lubes because they have a much higher pH.
Hmm.
Making sure your partner is using condoms again, not ejaculating into you is really important. But also when we think about the oral microbiome as well, if there's oral sex, you may need to use a denture dam, really unsexy, but basically it's like a sort of rectangular piece of latex that
Hmm.
you can put over the clitoris to perform oral sex. You can even buy latex disposable pants as
Hmm.
well to use for this part. So that's something that can be done. And then urinating straight away afterwards, washing with warm water only, avoiding douching, as I mentioned. If you can do a sitz bath, that's fantastic. So actually bathing the vulva in a bowl, if you can get it into a bowl, you can buy them on Amazon where they sit on the toilet, and bathing the urethra and the vulva in a warm, strong green tea or a sea salt water, whatever sort of works best for you. That can be really useful for stopping translocation of bacteria from occurring. If there's no cuts or tears afterwards, a lactic acid pessary may be beneficial for bringing the vagina back to that
Hmm.
acidic space that we want it to be. And then vaginal probiotics, if you can get hold of them. There is a product that's come over to this country recently called V Probiotic. Which is they call it a suppository because it's American,
Yeah.
but you can certainly get that in the States, and that can be used after sex to try and bring back the vagina into a robust lactobacillus environment, unless you have too much of certain lactobacillus strains, and then that can cause more problems. So
Hmm.
this is never like across the board, everybody can do these kind of things. But also teas might be helpful as well. So garlic, corn silk, buchu, nettle, ginger, parsley. I actually have a short webinar on my website that gives you information about teas, of how you can use them for your bladder. But
Okay.
that can be really nice to drink after having sex as well, to help to flush anything through, and then you'll be urinating more as well. And try not to stress about it. So easy for me to stand here and
Yeah.
say that, but breathing into the pelvic floor, relaxing, and knowing that you've done everything you can to help yourself and to support yourself.
If you have the link to that video about the teas, we can also put it in the video
Sure,
description so people can find it. You
sure.
mentioned water-based lubricants. We did get a couple of questions about whether you can use other things like coconut oil as a lubricant or if that could actually cause more problems.
Yeah, so if you're using a condom, you can't use an oil because it will denature the surface of the condom and make it not protective. And obviously, we don't want people getting pregnant, and because that's a massive life change.
Hmm.
So yeah, using water-based lubes if there's condoms there. But if you're not using a condom, if you're postmenopausal, then yeah, you can use an oil. I think olive oil is better generally. I find coconut oil can be a little bit drying for some people.
Hmm.
But if it suits you and you like it, then that's fine. That's okay, I think. There are some good water-based pH balanced lubes out there, like Yes and Hanks do some. There's more than that, but I think it's just important to do a little bit of investigating into that side of things. There's a
Hmm.
product called Olive and Bee that I use with a lot of my clients in terms of a sort of vulvovaginal moisturizer that can be used as an intimately as well, because it's allowed to go
Okay.
inside, and that can, it's just olive oil and beeswax, but just olive oil on a good quality cold pressed olive oil can be useful. There was one research paper where it was shown to support the growth of Lactobacillus crispatus, but reduce the growth of Lactobacillus iners, which can sometimes be a little bit problematic, even though it is a lactobacilli. And
Hmm.
so olive oil is kind of one of my go-tos for people, definitely.
Could oils like that also provide a protective barrier for swimming? Some people say that their UTI symptoms are triggered when they swim, and they've asked about things like that.
Yeah, it's really difficult, isn't it? Some people use like a petroleum-based
Mm.
Vaseline on there. Um, Maybe you'd have to try it out and see. I think you need to wash straight after with the chlorine in the pool. It's the high
Mm.
concentration of chlorine that I think is probably
Hmm.
causing the issues. And then that epithelial lining the skin inside the urethra or even on the vulva can be disrupted by that chlorine presence. Um, I think that with swimming, as soon as you get out the pool, swimsuits off, showering, particularly when people are on holiday as well, not sitting around in wet swimwear is really important.
Hmm.
Shower, change, put on just take loads of bikini bottoms with you or loads of swimsuit changes and just keep on changing throughout the day. It's boring, but if it reduces symptoms from occurring, then it's really
Hmm.
important.
Yeah. The other thing that people ask about is for people who work long shifts and can't use the bathroom a lot or who frequently travel on long flights. Do you have any tips about how to manage that and prevent UTI?
That's a really hard one
Mm,
because sometimes I think we have to assess, like, is my job actually impacting my health? And if you are prone to UTIs and you aren't able to use the bathroom very often, then that is a massive impact.
mm,
And, I understand that not everybody can just change their job instantly, but it is something to maybe consider and to sit with and to work through. So you do need to empty your bladder fairly regularly, at least every 2 to 3 hours.
hmm,
And if it has to be longer than that, maybe that's problematic for you and causing more problems. Stay hydrated. Don't not drink.
mm,
We need to keep flushing the bladder through. That is how the bladder is meant to function. And when we don't drink enough, we do allow just the normal bacterial flora that's in there to become more and for it to become more acidic as well, which can cause problems for lots of people. So it doesn't have to be huge amounts of water, like glugging it down, but just sipping, hydrating
hmm,
continuously through the day. And that can be herbal teas as well, as I mentioned earlier. You can sometimes, if your shift is at certain times, you could hydrate earlier and then maybe not quite so much whilst you're on your shift. But if you're doing a 12-hour shift, for instance, you do need to hydrate over that time. And maybe talking to your boss about being allowed more toilet breaks. This, I think, probably comes under human rights somewhere,
mm,
surely. If it's not, then as I say, maybe you need a different job. Don't, empty the bladder just in case though as well. So, there's a lot of my clients are, if they're leaving the house, they empty the bladder. When they arrive somewhere, they empty the bladder. Like they do it just whenever there's a toilet,
yeah.
they'll empty the bladder. And you can actually change the signaling system of your bladder of understanding when it's full if you're emptying too often. And that sort of comes in with bladder retraining, which I'm not trained in, but I very gently will talk to my clients around just, of course you should empty if you feel you need to, but
Hmm.
if you have just emptied, do you really need to go? Can you hold on a little bit longer? But if you are getting in a car and you know that 20 minutes down the road you'll be able to urinate when you get somewhere, do you really need to go before
Mm,
you leave the house? Avoiding dehydrating drinks as well. So coffee, fizzy drinks, alcohol. That's not that you'd be out drinking alcohol whilst you're at work, hopefully, but it's still something to be considering. If you're drinking alcohol the night before, you might be more dehydrated the next day. Long flights are really hard. You do need to keep dehydrated on a flight. You need to keep hydrated on a
yeah.
flight and empty your bladder regularly again then as well. So try and get a seat in the aisle so that maybe up closer to where the toilet is, and avoid wearing tight trousers and get up and move around, even if you're just walking up and down
Hmm.
the cabin. Sitting still for long periods can make things worse as well.
All good tips, and many of them I've implemented myself on long flights. And this has been a really interesting chat. What ways can people work with you if they'd like to get in touch about their own health journey?
So I work one-to-one with people. I work quite closely with them over 3 or 6 month programs, which can be extended out longer if needed. For bladder stuff, generally it is 6 months. It's very rare that at 3 months we see resolution of all symptoms.
Hmm.
Unfortunately, I wish I could change that, but I can't. I also run group programs as well. There's a new one starting in January where I pass over the information that I give all of my bladder clients. I'm running one at the moment on Candida, and again, that's slightly different. It's more about vaginal health.
Hmm.
That will be run again next sort of September time. So it's the basics. It's a way to get going with all of the basics. And there's workshops where we come together to talk through everything that we've learned. So it's part education, part practical tips. And there's a section on supplements and lifestyle advice and nervous system support and diet and nutrition and all that sort of thing as well.
Okay, great. We can put the link to that in the description as well so people can learn more about it. And I
Thank
wanted
you.
to thank you again so much for sharing your time. It's been really interesting.
Thank you for having me.
Thanks so much for watching. I hope you found this expert video helpful. If you'd like to learn more about this or related topics, be sure to check out our other videos or head over to liveutifree.com for related articles. We'll drop some links in the video description. If you like what we're doing on this channel, you can support our work by hitting subscribe here on YouTube, and don't forget to tick the bell so you'll be notified of our future videos. Thanks again for watching, and until next time, keep asking questions and pushing for better solutions.